Welcome to the webinar. We'll begin shortly. Welcome to the webinar. We'll give it just a minute more to let folks sign in before we get started. Hello, everyone, and welcome to the webinar. My name is Mindy Mitchell. I'm a senior technical assistant here at the National Alliance to End Homelessness. I have just a few housekeeping items before we get started. This webinar is being recorded, and all registrants for the webinar will receive an email with an accompanying link to the recording, the slides, and additional resources within 24 hours of this broadcast. All attendees are on mute and will remain so throughout the broadcast, and all video functions have been turned off for attendees. The Zoom chat function is also disabled, but if you have questions, please enter them into the Zoom Q&A box. The questions will be held until after all presentations are complete, and then there will be a time for Q&A in which all panelists will participate. Any questions that we don't get to will be gathered by Alliance staff and will be included on the Ending Homelessness Forum, which Sharon will tell you about at the end of the webinar. Now, to get us started today, our moderator for the webinar is Dr. Sharon McDonald, Senior Fellow for Families and Children here at the National Alliance to End Homelessness. Sharon, you can go ahead and unmute yourself and turn on your video.
Hi there. I am trying to figure out how to, here we go. Thank you. Sorry, I'm not very competent at this. So thank you very much, Mindy, for the introduction and for everyone who's joined me, and especially this really wonderful group of panelists. Mindy, if you could go to the next slide. I want to provide an overview of what we're going to be talking about today. Very quickly, this is a very understanding the intersection of domestic violence, trafficking, homelessness, and housing insecurity is the work of many, many people and decades of work. And so we're not going to cover everything that we would like to cover in today's webinar. So I really see this as a beginning point, but we are going to very quickly provide an overview about what homeless service providers and systems leaders should know about serving survivors during this pandemic. We'll also talk about advancements in integrating service systems and practice, integrating the domestic violence, trafficking, and homeless service systems in serving survivors at the intersection of homelessness and domestic violence and trafficking. And finally, we're going to have a discussion around how providers are modifying services in light of the pandemic to protect survivors and staff. So we are anticipating more of a robust conversation and very few slides here. So we're really grateful for you joining us. Next slide. So who do we have today? We have Debbie Fox with the National Network to End Domestic Violence, Karen Romero with the Freedom Network USA, Samantha Floyd with the National Survivors Network, Amy Turk with the Downtown Women's Center in Los Angeles, Elizabeth Eastland with Rainbow Services, also in Los Angeles, and Cecily Dove with Crossroads, Rhode Island. This is a wealth of expertise. And again, we're going to get some of what they know. They have a wealth of resources on their individual websites, and we have links to those towards the end, and they are also have provided me with resources for you to share and for you to review in our in the National Alliance to End Homelessness Forum. Next slide. So I want to introduce you very quickly to something that's going to be very important to the Alliance's work over the coming months. The Alliance, in partnership with other friends, other national organizations, including Anna Leva with the Center on Budget and Policy Priorities, has come up with a framework to think about how to respond to COVID-19 in the homeless service system, practice strategies, policy priorities, areas of growth. We want to recognize in this framework the importance of having a racial justice and equity lens. COVID-19 and homelessness does not have, is not race neutral. People of color, disproportionately African American, are being victimized by COVID-19. They're being disparately harmed, and they also are among those most impacted by homelessness, as are other groups. So the data is coming in on COVID-19. We're going to learn more, but historic injustice has long been evident in the homeless services data. The framework, which is up on our website, looks at phase steps, things that we need to be doing immediately, things that we need to be doing in the very short term, things we need to be doing in the medium term and long term. It's a very dense document. We're not going to cover it all today, but I wanted to give you some sense of what's in there. It looks at 6 domains of practice: unsheltered homelessness, sheltered homelessness, housing, prevention and diversion, and how to strengthen our homeless service systems for the future so that we're not reverting back to what wasn't working before. So I want to urge everyone to take a look at that. It's framing our conversation today. Our discussion is going to be using that template, and it's going to frame a lot more that happens that you'll be seeing from the Alliance. So we'd love to hear your examples as we move forward. So that's our goal for today. And to kick off the conversation, I want to turn it to my friend, Debbie Fox.
Thank you so much, Sharon, for that introduction. And I'm so happy to be with Sharon and the National Alliance to End Homelessness and all my partners in the field that are on this webinar today. It's good to be also with you all, everyone across the country. I'm Debbie Fox. I'm the Housing Policy and Practice Specialist here at the National Network to End Domestic Violence. So just a little bit of an overview of the National Network to End Domestic Violence. We are a membership organization of the 56 state and territorial domestic violence coalitions, and then in turn those coalitions work with local domestic violence programs in their state. So like all of you, we're really busy at NNADV working to be responsive to the need of domestic and sexual violence survivors during COVID-19 from a number of ways of getting information and technical assistance and training out into the field and helping pivot and innovate in the field and change practice models, and also to do policy work and look at increased resources and funding to address the impacts of COVID. And I do this work in community with a bunch of folks, as you can see on the slide here, that are part of the Domestic Violence and Housing Technical Assistance Consortium. So there's a number of us working together with one another, and I'll just go through the names really quick. You can see them there, but I work closely with the National Resource Center on Domestic Violence, the National Alliance for Safe Housing, the National Resource Center on Sexual Violence, and also we work really closely with the HUD-TA Provider Collaborative Solutions. So we have a website. You can see our logo in the corner there, the Safe Housing Partnerships logo. We have a website where we're gathering information on COVID-19 in particular, and the intersection around DV and SA and housing during this time. And then we also are doing like the NAH, we're doing a weekly webinar series on the intersection of domestic violence, sexual violence, and housing. And so those are every Thursday from 1 to 2 p.m. You can go to the safehousingpartnerships.org website to register and for more information there. And then I also just wanted to additionally give a plug for another webinar that is coming up that is not, it's not facilitated by the consortium, but it's our partners at the National Resource Center on Domestic Violence are working closely with the Native American women and leaders and elders on gender-based violence and housing insecurity for American Indian and Alaska Native survivors. So I'll send out a link as well for that webinar that is coming up on May 27th. That's very critical during this time. As we know, Native communities and tribal communities are heavily impacted by COVID. So to go a little bit deeper about what we'll be talking about and discussing today, as Sharon highlighted, the impact of this virus is felt most by the at-risk and marginalized populations due to historical inequities in our country. And domestic and sexual violence is disproportionately, it does impact people of color, people that identify as women, LGBTQI, marginalized communities, including women of color that include Native American women, African American women, immigrant women at the highest level. And we know that women and LGBTQI populations are disproportionately represented among low-wage workers and service workers who are deeply impacted and are being laid off at high rates during this COVID time. And they also are being put at health risk as essential workers in our country. So, you know, as a time that we're thinking about doing the right thing of social distancing, physically distancing, working from home, retreating to our homes, which is the correct public health guidance, we are also reminded, especially those of us working in the domestic and sexual violence field, we're reminded that home is often not a safe place for a lot of people. And then now it's become even less safe for a lot of victims and survivors, that they're basically essentially trapped at home with their abusers during this time. So there's many shifts that we're trying to make in our field in terms of addressing the increased needs of those who are at home with abusers, but then also looking at our shelters who are really busy moving to temporary accommodations and doing similarly what homeless programs are doing, moving to shelters that are hotel, motel based to get survivors out of the communal settings for public health precautions. So those are things that we're working on. And then also, you know, we're thinking about the survivors who recently just got on their feet, maybe just got into permanent housing or rapid rehousing. They're also threatened now with job and unemployment insecurity and eviction. And we're trying to make sure that those survivors are staying safely and securely housed during this time. And then we're also looking at how do we work with survivors who might be trapped at home to do safety planning within the home as they're reaching out, and how do we move and be nimble and move to remote and digital services that are also confidential. So we have seen concerns during this time related to COVID-19, lack of access to programs, across the board. Many domestic violence programs are full, homelessness programs are often full and busy. So we're trying to respond to the increased need, and then also thinking about any external factors and added stress and financial strains that can negatively impact survivors, where their safety is compromised and their isolation is increasing. So as we know, abuse is a tactic about power and control, and abusers can use those tools to exert that, including this time of a national health concern such as COVID. Like, we're hearing stories of abusers threatening to pass on the virus to their partners or to their families. So these are serious concerns. And then we also know that from the NADV, we do a census every September. So in normal times, there's a lack of resources for housing. So, and people are turned away. So we're always trying to figure out how to innovate and respond to safety with not all the resources that we need. So lastly, I just want to wrap it up really quick, because I have other folks present and the programs that are on this webinar. I just want to discuss some steps that the homeless services systems can take, and it has already taken many steps over the years to better identify and support survivors. We are seeing so much, and you'll learn more today from the communities on this webinar, that the partnerships that have been built over the years across the systems with the homeless service sector, the victim service providers, have been so critical for us to be able to address COVID, and already having some of the coordinated entry screenings in place that are confidential for survivors, that they can be asked questions without their abuser next to them. That those things have really come into play during COVID. And then we know that the HUD Continuum of Care domestic and sexual violence bonus projects have facilitated increased resources to address the need of victims, and have increased funding into victim service programs from the COC, and also for homeless programs that serve survivors, while also incorporating more voices from those with lived experience that have experienced domestic and sexual violence. So we're seeing some really innovative, rapid shifts and new models, and seeing things that really work. And we are hearing from programs that they would like to plan to do some of the mobile and tech related pieces, that it's really working for both the advocates in the field and survivors accessing services. So these remote, tech safe, confidential solutions have been great. And then I just like to leave on a high note, like we heard recently, one example from the Connecticut Coalition, and they partner with the Connecticut Coalition to End Homelessness. They quickly, with their DV bonus money, went to house 40 survivors in March. And they were able to respond quickly to those needs with those new resources from the DV bonus project, and respond. They were able to respond to COVID-19, all while doing this work remotely. So many great things are happening, and we're always happy to hear about the innovations. And then at this point, I'm going to pass it on to Karen Romero from the Freedom Network, and she'll be telling you more about their work and the responses happening in the field for survivors who are being trafficked. And I just want to thank everybody for joining this webinar and for all the amazing work that you're doing out in the field. So thank you.
Thank you, Debbie. Karen?
Hi all, I'm Karen Romero. I'm the Training Institute Director for Freedom Network USA. We are a national coalition of direct service providers and survivors working to address a rights-based approach to human trafficking. So I'm sure that most people have heard of the term human trafficking. I feel like, unfortunately, we're a little behind as far as partnerships with the housing and homeless services field when it comes to the anti-trafficking field. We've seen all the great work that has happened with the DV field in collaborating and partnering with the housing and homeless services programs. And so we're hoping to be able to continue on that track and be able to really fortify some of those relationships. And so for those of us that may not have or be as familiar with the crime of human trafficking is basically when an individual is forced and exploited into commercial sex or for labor by using force, fraud, or coercion. And so we know that there are a lot of misconceptions around what human trafficking looks like, who it affects. So just to clear a couple of things up, one is that commercial sex or sex work does not equal human trafficking all the time, or one does not equal the other. So it can happen within commercial sex, but also it does not mean it's the same thing. And the other is that oftentimes people believe that there is more sex trafficking that happens than labor trafficking. Although, you know, statistics can vary, what we see is that oftentimes labor trafficking cases are more difficult to find. One, because, you know, people don't self-report, but also because labor trafficking is often hidden, especially due to exploitative labor conditions. And there, you know, labor trafficking can really happen in any sector of work that you can imagine. So just wanted to start off there, and I'm sure we'll have more time to answer questions. So let's go to the next slide. I think what we've really seen nationwide is that COVID has really highlighted a lot of the flaws in the systems that are meant to serve really individuals, but definitely survivors. We know that housing is a critical need, and that individuals need access and to be able to maintain long-term stable housing. And although a lot of the emergency resources are useful, what we're seeing now is that shelters are either scrambling to understand how to best maintain staff and keep them safe, both the staff and survivors within shelters. Some shelters are closing down and not letting more people in because they're trying to figure kind of their own process. And other shelters are struggling with, you know, how to maintain social distance, how do you maintain, you know, health, and also encourage the autonomy of individuals within the shelter. And so these are, you know, challenges that we're seeing. On the human trafficking side, a lot of anti-trafficking organizations do not run shelters. So a lot of them are programs either legal based or social services based, where often they're trying to work with the local community and their partners in order to meet, you know, those needs around housing. And so what we are seeing is that for the shelters that do serve survivors of trafficking, most of them will only serve the female identified survivors. And this is not just now in COVID, but it's been historically. And also a lot of shelters really exclude male survivors, labor trafficking survivors, LGBTQ survivors. And so we're just seeing those challenges highlighted during this time. I think one of the three buckets, or a few of the buckets that we've seen, is kind of the response within shelters, housing insecurity for survivors who either have a place to stay, or, you know, and they're facing eviction due to job loss, and also underserved populations. So specifically undocumented individuals and youth survivors. For undocumented survivors, and I'll share a couple of pieces that we're seeing, but these are kind of the main buckets that we're seeing coming out from the anti-trafficking field. Can I get the next slide? Perfect. And so what we're seeing around housing insecurity is that a lot of survivors who are housed are losing jobs. And if you think about it, human trafficking is a crime, a financial crime. The trafficker is exploiting that individual with, you know, to get financial gain. And as that individual exits and is able to escape that trafficking situation, oftentimes they are coming away with little or no money. And that housing is really their primary need. And so for those who have been able to be housed, a lot of times, and right now we're seeing this a lot, is that a lot of people are losing jobs and they're facing evictions. A lot of our foreign nationals who are undocumented, whether it's true or not, within their state, some of the landlords, we're hearing that they're threatening to evict them because they believe that they don't have any rights, which, you know, it's not true, but also it does vary state to state. So we're trying to work closely with our housing providers, or other housing legal service providers, to really understand, you know, what applies and what rights everyone should have at this point. Another piece that we're seeing is actually for us, we're seeing within our membership, which is national, we have 68 members across the US, organizations and individuals, is that a lot of them are seeing an increase in new cases as far as getting calls for services, but also they're seeing an increase in some areas where survivors who had already received services and maybe were kind of like on track to be able to sustain and maintain housing, they're calling in because they need services again. So it's kind of seeing the new the new survivors that are at least identifying, and also previous survivors that are coming back for services. A lot of the programs that we're talking to, they're relying heavily on hotels because they're not able to access shelters or other housing systems within their community. And I think there could be, you know, a myriad of reasons for that. Some of the reasons are, you know, some of those shelters are already tapped or at capacity. Some of them are not giving priority, or, you know, sometimes the way that we see priority and maybe the way that other sectors see priority is going to be different. And so, you know, sometimes we have definitely been told like this person is not homeless enough, right? Even if they're staying in a very unsafe place. So we're hearing that come up. And another thing that I think has been coming up nationally, and it's not just with survivors of trafficking, is that there has been coercion by landlords by soliciting sex in exchange for rent. And as we know, you know, if you're using force, fraud, or coercion in order to exploit someone for labor or for sex, you know, it can be considered human trafficking. Obviously, you know, every individual case would want to be reviewed and have some legal advice in order to address that. But we just want to make sure that people know their rights. And there is a housing initiative from the DOJ, I believe, around sexual harassment in housing. And I included that in one of my last slide. Next slide. And so in response to COVID, we've been seeing a lot of our programs who are funded through the Department of Justice, also through HHS. They are trying to request grant adjustments in order to meet the housing needs more quickly. It's still, you know, a process. And so we're really urging them to connect with their local service partners around housing and homeless services, because that trafficking individuals and survivors, whether they identify as a trafficking survivor or they don't want to publicly self-identify, they are still experiencing housing instability and homelessness, and they should still be eligible to receive those services. They are doing long-term hotel stays for, you know, the areas where they're able to. They're using a lot of technology in order to do case management, a lot of remote advocacy, and we've seen a number of places working to do a lot of rights, know your rights for tenants, especially given the challenges with landlords right now. And then next slide. And the following slide is just some additional resources that you can access in order to learn more about how service providers are responding to trafficking, especially during COVID. We have some FAQs that we did just a one-pager, I think it's maybe 2 pages, based on a listening session that we co-hosted with HUD and NSN. And also I shared the website for the DOJ Sexual Harassment in Housing Initiative. We also have a resource library that has a bunch of housing information around trafficking survivors. So I'll go ahead and pause there and I'll wait for questions.
Thank you very much, Karen. And I'm delighted to introduce Samantha and ask Samantha to tell us a little bit about what gets lost when we're not incorporating the lens and the perspective of people with lived experience when we're designing our programs, and why that needs to be central as we're rethinking about how to respond during this pandemic.
Okay, thank you. My name is Samantha Floyd. I am a survivor of human trafficking as well as a master's level social worker. I've been a member of the National Survivor Network since 2015. I served as a policy champion with NSN from 2018 to 2019, and I served as the communications chair from 2019 to early 2020. One aspect of NSN's and my personal work is to provide direction and assistance in building competency and capacity of anti-trafficking programs and organizations to be survivor informed and to provide lived experience expertise guided at all levels of their work. NSN published a policy brief that is part of the resources on the maximum involvement of survivors of trafficking, and I was the lead author of that brief, and so that's one of the resources that will be provided. And so just like, you know, any social service field or even in business, if you're not understanding the people that are, you know, purchasing your services or accessing your services, or that you're meeting, if you don't understand what their needs are, it's very unlikely that you're going to be successful in what you're doing. And so in addition to just kind of after the fact doing like a satisfaction survey, we believe that organizations are most impactful when they incorporate that lived experience expert, that survivor leader at all areas of their service, serving on the board, working as staff, both program staff and administrative staff, serving as volunteers, having relationships with survivor-led organizations in the work that you do. And, you know, we feel that without that perspective, not only will your services be less effective than they could be, but there's potential is there to cause harm, particularly with this population, just because the large scale nature of their needs and because of the control and exploitation they've already experienced, they may not be in a place to self-advocate. Thank you.
Okay, thank you very, very much, Samantha. So I want to now turn it on to a discussion, but first I want to hear from each of the frontline providers, people who are creating change in their own community. And so I'm going to first turn it over to Amy to share with us how are you and how is the city, county, and state responding to the shelter needs of people experiencing homelessness, of women who are in Skid Row, and of survivors? That's a big question, but all of those things.
Thanks, Sharon.
What can you tell us?
Yeah, so in Los Angeles County, just a little bit about Downtown Women's Center. We, under normal times and currently are expanding even, serve about 5,000 women experiencing homelessness through a number of ways: permanent supportive housing on-site and throughout the community. We have a co-located health clinic with a partner federally qualified health center. We have an access center. We help women find jobs, whether with us through our social enterprise, where women are making handmade products and staffing our cafe and resale boutique, and also supporting women in bridge housing. And in our community, we've really made some shifts to ensure that individuals who are older and have underlying health conditions, who are very vulnerable, not more vulnerable to COVID, but if they contracted COVID, would be very likely to pass away. We've been focusing on them the most and moving them into hotels that are a part of the governor's initiative called Project Room Key. And this is a FEMA reimbursed initiative and has been one of our main responses. Fortunately, we've been able to open up one whole hotel for women, and you'll hear more too how some of the hotels are being opened up for domestic violence survivors.
Thank you very much, Amy. And I think I jumped the gun by going straight to that question, when really what I was intended to ask you was to tell us a little bit more about Downtown Women's Center, which you did do. Is there anything more that you can tell us about the experience of violence and trauma and the history of the women that you have historically served in your programs?
Yeah, so the Downtown Women's Center is sort of traditionally seen as a homeless service provider, but of course, a majority of the women have experienced gender-based violence. We produce a report every 3 years because the information that we get out of the point in time count doesn't really tell you much. In fact, it was only in recent years that a percentage of women experiencing homelessness was distilled from our point in time count. So most recently we produced a report, I'll show you a little picture, called the LA City Women's Needs Assessment. And this was of 300 women that we surveyed throughout the city geography of Los Angeles. And you really find that that intersection of homelessness and gender-based violence is quite prevalent. For example, 53% said that they had experienced domestic violence over the course of a lifetime, and 36% within the last year. And overall, 60% had said that they were a victim of crime in the last year. So just high levels of complex trauma among the population that we serve that really demonstrates the necessity for gender-based services or services through a gendered lens.
Right. And your organization has historically served, you're providing permanent supportive housing and a range of support services to women experiencing homelessness, but a good number of the women that come through your doors on any given day are unsheltered. Is that correct?
Yes, unfortunately, a majority of the women we do see are literally living on the streets or in nearby shelters. And so, you know, we're working as fast as possible to find them permanent housing solutions.
Right. And if you don't mind me asking, I think that Los Angeles had done a survey, a comparison of the vulnerabilities of those in shelter versus those in unsheltered. Do you happen to recall that offhand? I can look it up after and post it on the forum if you don't.
Yeah, there's been some work out of UCLA, the Policy Institute, I believe it's called. Janae Roundtree is the researcher. She's actually looked at it through federal data. And when you look at the healthcare needs of unsheltered individuals and the longer lengths of time experiencing homelessness, but she also noted that more women were likely to have longer lengths of homelessness, worse health outcomes, and longer paths to finding permanent housing. Upwards of like an average of 15 years or so from the point of homelessness and until they find permanent housing again. So many more years than men is what she was showing.
Yeah, it's really interesting. And just as for folks listening in, the Alliance released the state of homelessness, I believe it was yesterday or this morning, looking at 2019 data. But one of the things that shocked me when I looked at it was there was a really big leap in the number of women identified in unsheltered locations nationally. That was really something that I think we all need to be taking a look at, because I think they're very, very vulnerable outside. Yeah. Thank you. Elizabeth, do you mind sharing a little bit about what you do in Rainbow Services, who you're serving, and the kinds of interventions you provide?
Sure, yeah, thank you. Hi, everyone. My name is Elizabeth Eastland. I work with Rainbow Services. We are a traditional, though innovative, direct service provider for victims of domestic violence. We run an emergency shelter, transitional housing, and we were one of the first organizations to implement a domestic violence housing first model that is funded through the California Governor's Office of Emergency Services. And we have been collaborating with Downtown Center to co-lead the Domestic Violence Homeless Services Coalition this is our 4th year, which has been amazing. And, you know, part of the coalition's focus is to ensure that the voices of survivors are at the core and foundation of our work. As part of the Domestic Violence Housing First program, what we've seen just this past year, there was a formal evaluation done of 19 organizations who are implementing that program throughout the state of California. And what they found was that 58% of survivors who were surveyed were able to prevent homelessness through this model. And that of those survivors, 40% were actually able to stay in their own homes. So those statistics are really good as we look towards advocating for additional funding to support survivors either in their own homes or getting to a new unit whenever we can find one anyways that's going to be affordable for them. So Rainbow Services has, along with our advocacy with the coalition, we work with our statewide partnership to advocate on policies and funding to ensure that survivors are supported during this time. And, you know, the more current message around COVID is that domestic violence has always been an epidemic, that this current pandemic has brought more light to the epidemic of domestic violence. And how do we continue that conversation? And how do we support survivors during this time? We're fortunate at Rainbow to be part of the City of Los Angeles's Mayor's Fund and part of the project Safe Haven, which allows us to support additional survivors beyond our shelter, putting them into safe housing. So I can talk about that more a little bit later. And I think that's it, unless you have other questions, Sharon.
No, that's great. Thank you very much, Elizabeth. And maybe folks can turn on, the rest of the speakers can turn on their videos, because I think it's going to become more interactive as we go. Cecily, I don't know if you got the camera to work, but I hope so, because I would love for you to tell us a little bit about what Crossroads Rhode Island's role in the homeless service system is, and your work to build bridges or improve resources for survivors of domestic violence and trafficking in your system.
Surely, good afternoon, everyone. And no, I was not successful at getting my camera working, so I've had several attempts. However, I can talk about, Crossroads and our impact on folks experiencing homelessness. So Crossroads is, we are considered the leading largest agency provider of housing and services to those households, individuals and families who are either at risk or experiencing homelessness. We have a range, or I think the trendy word is called suite of services we offer our population. Not to mention, we are the in partnership with the local coalition as the state's coordinated entry lead. So in addition to that, we offer 24-hour emergency services. We have employment and education, where we have about 450 participants a year, comprehensive case management, a range of housing options from rapid rehousing, permanent supportive housing, rental assistance. We own and manage more than 370 units of permanent supportive housing statewide, as well as really, I would also add, really, the leader of really implementing really housing first focused programs. As Amy, based upon that description, Crossroads is primarily a homeless service provider. However, in terms of the content of this webinar, we grew to really carve out specialized services and support for survivors of violence. And like Amy, we had historically been seeing folks in our shelters, in our women's shelter and our men's shelter. Just to put a pin in it, Crossroads also operates the largest men and women's shelter in the state. So we had no shortage of folks experiencing violence, as well as the largest family shelter. And so undoubtedly we were seeing the numbers very similar to Amy. About, I believe 2018, about 55% of the women in our shelter had experienced violence. Similar numbers in our family shelter, and obviously a smaller number in our men's shelter, but definitely we were seeing them. They were in the homeless system. And so really, probably about 6 years ago, we were in collaboration with a local victim service provider. And through a affiliation agreement, we merged with them, or they merged with us, and that organization became the Domestic Violence Program of Crossroads, where again, because of the intersection of homelessness and violence was becoming so rampant, and prevalent, I guess, we said, we've got to figure out how to do this better and really more strategic in terms of accessing resources, getting really specialized support for that population and the funding. And so our program grew, and so we offer a safe house for about 26 individuals, which is a combination of individual single women or men and families. Case management, we have a rapid rehousing program that is funded by VOCA. That is in our third year of funding. We also have employment and education support specifically for folks in our safe house. and in the rapid rehousing program as they work to, strengthen their financial capacity and dependence. And so, yeah, I can go on and on. We're doing a lot. But again, I'm happy to be a part of this conversation, and I think it's really valuable.
Thank you, Cecily. I actually want to keep on your microphone there for a second. You mentioned VOCA. I'm wondering if you could be specific around how VOCA, what it is, and how it's being used in your system, and then maybe Amy and Elizabeth could add to that answer.
Sure. So VOCA, the Victims of Crime funding, we have had two different grants funded by VOCA. One really was birthed out of this idea of how do we do this intersection of homelessness and domestic violence. And so it was really the first iteration of what we call the domestic violence assessment specialist, and that person actually sat at the front door of the homeless system, and so was able to provide specialized support, triage, safety planning for anyone coming through the homeless system, and really able to connect them to the appropriate resources, be it victim services or other supports. We had that grant for about 2 years. It was highly effective, but it, as the funding became more scarce and folks, jumped on the VOCA train, it became more about how do we figure out what else to do with those funds, and then we applied for our rapid rehousing, which again, this is our 3rd year. We're applying, we're in the RFP process now, applying for those funds. And again, we've been wildly effective at it. Again, because Crossroads for a little while has been really focused on the housing first, right? Since 2014, we have been determined and destined to really have that as our lens, that everyone has the right to housing. And so how do we take that philosophy and bring it over or integrate it into our victim service supports? And again, it's what survivors saying that they want. They want housing, they want safe housing. And so how do we do that? And how do we do it rapidly and safely? And so, yeah, we are hopeful that we're going to get funded again. One of the things kind of as it relates to COVID, we've already obviously started seeing some of the financial impact of the grant, and how we were projecting spending the resources. We anticipate that folks are going to stay with us a little longer, and really trying to have conversations now in writing the renewal, how we anticipate that this is going to impact the next level of funding. We're going to probably serve less folks for a longer period of time because folks are suffering with the loss of their jobs or other entitlements that they are privy to. So it's definitely something that it's the funding resource that has been extremely valuable in serving our survivors.
Elizabeth, anything you'd want to add in there?
Sure, I'll just share that the state of California was one of the first states, actually I think the first state, to use the Victims of Crime Act funding specifically for DV Housing First. And just in case there's people who are not familiar with the model, the DV Housing First model has 3 main components. One is the flexible funding to be able to support people, whether it's with rent, auto bills, any type of thing that's going to help them stay stably housed. The second part is survivor-centered mobile advocacy. So really helping people understand what their options are and having the survivor make the decision about what's best for them and their family. And then the third component is community connections and creating relationships with people in the community, not just landlords, which is like the most important part of it all, but also with furniture stores, automobile shops, appliance stores. So those are the key components of DV Housing First. And with the Victims of Crime Act money, that has supported 66 organizations throughout the state of California, including 16 in Los Angeles County. So we're really fortunate to be able to have that. And I think that for those who are not familiar, it's basically rapid rehousing, but with several other components to ensure the success of survivors beyond the rental support. So in the state of California also, I would say half of our shelter funding also comes from the Victims of Crime Act money. The other part comes from our state general funds.
Amy, anything else that you would want to add?
That the model, the domestic violence housing first model, has become our advocacy platform of because it's what we hear survivors need the most. When we started the coalition that Elizabeth mentioned, Domestic Violence Homeless Services Coalition, we kicked it off with a number of focus groups of women at the intersection of domestic violence and homelessness. And number one need was just the flexibility of finances to get over a barrier. And Domestic Violence Housing First really is that model. And our advocacy has led the city and county of Los Angeles to pilot that too in other programs outside of the VOCA funding. So it's been nice to see it expand a bit and for people to also figure out how to work their traditional rapid rehousing programs with more of the lens of the DV housing first.
Great. And could I ask you you and Elizabeth to speak very briefly about some of the benefits of coordination and how you got started, maybe tips for success? Well, we can provide more detailed information in the forum, but just to get us started, Amy, why don't you start and then Elizabeth can add in.
Sure. I mean, the coalition started basically because we were upset that survivors were falling in the cracks of siloed systems, DV services, homelessness service. We noted that homeless services needed to be better on trauma-informed practices and that DV services needed to be better in finding people permanent housing and understanding the housing side of it. And we also wanted to be at the table of decision-making in our programs and policies in our community. So a number of moments converged and we formed a coalition, and of foremost importance was the survivor's perspective. So we have survivors in our core leadership. We are training survivors to be advocates, and we don't go out and advocate for anything unless they're with us or have informed the policy platform.
Yeah, I guess I would just add that some of the benefits. I'm sorry. Okay, I just think the benefits of the partnership is really the different silos trying to understand our various approaches, right? So as Amy talks about trauma-informed care, understanding permanent housing, but also just in creating relationships so that DV advocates and homeless service advocates have a better connection and are able to connect with one another to best serve survivors. And for, while our main focus is domestic violence, wherever we can, we try and bring advocacy for victims of human trafficking and sexual assault. So whenever that makes sense to do so from a policy platform, especially like when we're talking about DV housing first and we're advocating, we recently advocated with the city to use some of our state homelessness money. We included human trafficking victims in that request because we understand it's so important. So they changed the wording around DV housing first to survivors housing or survivors first housing, which is fine. It doesn't matter what it's called, as long as we are trying to stay true to the model, it's really important. So beyond just the focus on domestic violence, we understand that all of these types of victimizations are interrelated. And I think just for Rainbow, we now have 2 positions that are part of the coordinated entry system in our area. And we're promoting that kind of model too, to have co-located staff so that our staff who are traditionally DV advocates have a better sense of how the homeless system works, how coordinated entry works, and then they could share that with our other staff members, but also to provide education to the homeless service providers on the unique experiences of survivors and being able to answer questions whenever there are cases that are traditionally seen as difficult or challenging.
Thank you. And Cecily, when you and I talked in preparation for this call, mentioned that having the traumatic violence and human trafficking expertise, deepening your knowledge has really allowed your programs to serve some of the women in your homeless service programs, and men, I would imagine, better. Could you speak a little bit to that?
Yeah, absolutely. Again, based upon who we have been historically seeing and how we are better able to serve them, we decided, currently I oversee 8 COC grants, one of them, which is the DVCES. But then, as we saw, I think Amy mentioned this, women kind of languishing in our shelters for long periods of time. And the resources just weren't there in our, within our VSP, rapid rehousing or permanent supportive housing, it just wasn't there. And we kept seeing that population grow. So folks who had either had a history, either as an adult or a recent history, or I think something to also mention, didn't have a recent history, and so they may not have been eligible for, DV specific resources. We said, how can we provide support and get them housed? And so we applied and were recently funded under the DV bonus money, a rapid rehousing grant to support unaccompanied women and men who have history of violence and trauma. And so we really think that this is gonna be a great opportunity to be able to get the women out of shelter, get them housed, and then really be able to wrap supports, around them, as well as get them connected to help them, start the healing process, manage their trauma that has, what we know oftentimes have gone unmet for years, and as they just languish in the system. And so we're excited about that opportunity.
So I want to make sure that we use the remaining time to really focus on the intersection here during the pandemic. How are you modifying your practices? What are some things that people should be doing? And we're predominantly, I want to ask some of the questions that have come in, but I want to first elevate a focus on shelter. I think one of the things in many communities where we had a lot of unsheltered people, that included people who are survivors of violence and trafficking, or may have had difficulty for whatever reasons to access shelter programs. What is being done to first increase shelter options for folks, make them attractive enough for people to go into? How are you supporting people? This is a lot of questions. How are you supporting people in those shelters? Any innovations that would be interesting? And then how are you keeping them safe? So if you have a survivor who's in danger, what are some tips you might have for folks? Who would like to start? Elizabeth would.
Sure. So, when the pandemic first hit, what we made the decision to do was not exit anyone from our shelter unless they had a solid plan, or unless they already had a solid plan of where they would be going to beyond that. So we've had people there for months beyond what we normally would. Luckily, through the Mayor's Fund, we've been able to house additional individuals and families in hotels. But that creates its own problems too, because they're not on site, we're not there with them. So we've had to really look at what does safety mean, right? And how can we support them from afar? We do have staff going daily to drop off needed items, but in our shelter, we are starting to see people move out. And so we've opened up being able to bring survivors in. So with our staff, when they do an assessment over our hotline, to talk about what the needs of the individual or family are, we're kind of assessing the danger level to see, is it more necessary for them to be in a secure and safe area, or are they going to be secure enough in a public area such as a hotel? And while, you know, we're not publishing where the hotels are, it's still kind of an issue to just even say hotel. But that's where we're at right now, just trying to ensure that those rooms that we, in apartments that we have available are going to survivors who are at probably the increased need for having more security measures in place versus those that are able to go to a more public setting. I mean, just similar to DV Housing First, there are some survivors who do not need to go to shelter, for whom it may be safe for even them to stay at home, and we support them financially. So that's how we're trying to adjust and assess during this time, is looking at who really needs to be in our shelter with those added security measures.
Okay. Amy, would you have anything to add?
I guess in our interim shelter, of course, we've actually moved our access center, which took the space of our interim shelter by day, and we'd set up the shelter by night. But we've made this space a 24-hour interim shelter and moved the access center to our parking lot. So we're serving people mostly outside and one by one coming in to use our showers and bathrooms and triaging their needs in that for our access center. On the hotel side, because we're in the FEMA sponsored model, which has a full array of service staff. So we're the lead service provider. However, the fire department is there supporting. Other county service providers are there supporting. And there's also around the clock security. So in the runway guard, it's really a more safe environment. However, we have been doing a lot of education on the dynamics of domestic violence so that it doesn't become a controlling environment either. You know, we're working with people who don't normally operate shelters, so it's been a lot of education of you know, you don't have to control people to keep them safe, but your presence here is helping people feel safe, but like helping them learn the language to use and understand the population that's living there right now has been our main focus with new partners.
I was very intrigued by Amy's observation that they've been using EMT. I think that's a citywide effort, because I think a lot of the people who are being placed into hotels are medically fragile as well, that intersection. Cecily, do you have anything you would want to add about how you're expanding shelter options and improving safety, because now they're not under the same roof anymore? So what are you implementing?
Yeah, so as I mentioned, we operate the largest men and women shelter in the state. So 112 bed men's shelter, which are double bunks and certainly not 6 feet apart, as well as a women's shelter who has about 40 women in it. And so it was, you know, it was very obviously that we had to.
Cecily, you go away. I don't know if that's just my computer.
I'm sorry. Is that better? I'll be right on the computer. Is that better?
You, Sharon.
Yeah.
Okay. Sorry about that.
Good.
So really, with the support of the governor and funding that came in, we as well, because it just of the close nature and proximity of such a vulnerable population, we as well move folks to the hotel, and we have staff there at the hotel managing and supporting folks as they manage the crisis of this pandemic. So that's been great to be able to have folks on site. In terms of our safe house and our family shelters, we were able to not necessarily move folks, because what we did is just altered our operational policies and you know, the way we did things, so we can ensure that folks were able to safely social distance, and that, you know, we limited the areas where folks would normally congregate. And so that's been that's been really great. I would say, just as a kind of a concluding comment, the fact that, you know, we're trying to figure out how do we keep folks safe by being socially distanced is the thing that we are encouraging folks to say. Being in your own apartment is the best way to social distance. And so we have been, it actually has been proven to be beneficial across our organization, across our subtops, in getting folks housed. I was on a supervision with my employee this morning, and we have 3, tomorrow will be our 3rd lease signing in our family shelter. And so I don't know if it's the impact of COVID on landlords and the economic insecurity and the ability of rapid housing and resources, you know, consistent resources, but it has been the motivator that has been really valuable in helping to get the flow through the shelter. So, and I will just say another innovative piece, and it might not be innovative for others, but, you know, part of what we were trying to do to help maintain our commitment to housing is, you know, figuring out how do we do apartment viewings. You know, folks were a little leery, landlords were a little leery, and so we said, well, we're gonna take a video and folks are gonna view the apartment by video. And so we became a Zillow, right? And so clients and households and program participants can say, yes, I love this apartment. No, I don't love this apartment. And what it has done, it has proven to expedite the housing process. And it's something that we will keep going forward once the pandemic ends or we acclimate to the new norm.
Okay, that's great. So now I have 3 places to jump off of, and I'm not quite sure where to start. First, you know, I think Cecily, everybody is going into some, you know, into the hotels in your community, whereas in Amy and Elizabeth's case, could go here or they could go here. So to the extent, and I think in Cecily, your diversion specialist discerns who goes here versus who goes here. So there's some inherent safety planning and thinking through who's going to be safe where. So to the extent that you have things developed that you'd be willing to share, could you send that so that I could post that on the forum?
Absolutely.
And then the second thing, I want also Debbie and Karen and Samantha to, you know, have this opportunity to weigh in, but I'm going to layer another question onto it. Cecily sort of transitioned us to the next conversation, which is around housing. How do we get people in housing? But we've also gotten some questions that have come in as folks talked about DV housing first, is does it make sense to put a survivor of violence into housing? Is it safe for them? Would they not be better off in shelter? Is this the right move? And you know what? I think I'm going to start with Samantha because I think she'd love this.
Okay. I mean, that's always a debate when we're not in crisis. It depends on the survivor and their situation, really. A lot of survivors don't feel safe in shelters. They have a lot of unknown people around them. They have kind of arbitrary rules that they may not have a chance to talk to someone about. There can be recruitment within shelters. There could be, you know, theft. There could be leveraging between clients, and that makes them feel further exploited or like they haven't actually left their exploitation. But again, if you put them in a housing situation where they're alone and they have just come out of trafficking where they're hypervigilant, they're used to a lot of stimulation, whether because of addiction or because of like constant control of someone else or interaction with other victims. So just being alone and still is really difficult for highly traumatized survivors initially. I mean, Karen can jump in on what her partners say, but as survivors, we recommend that survivors just coming out of their exploitation be in a program that is monitored 24/7. And so that they always feel like someone is there and they always have someone accessible if they, you know, have an issue with their PTSD, if they get into some kind of crisis, whether it's, you know, physical or mental health. So it's really going to depend on that person, and that's where you really want to have a competent human trafficking person accessible to help make that analysis.
Karen or Debbie, anything
Yeah.
you want to add?
Yeah, I'll just add real quick. Yeah, so I think that's a really great point. It's really taking each survivor where they're at. I think it's really important, and we've been having this conversation, I think, for a while on determining whose determination of safety, or whose definition of safety we're really meeting. Is it that we're meeting the survivor's definition or our own? And I used to work in a domestic violence shelter, and I remember sometimes we would be worried and we would throw out the word like liability. Like we have to be careful because of liability. And I think that usually kept us in our heads safe, and it allowed us, it was a way for us to screen out, unfortunately. It's to say that client it's going to be too difficult, and so we ended up maybe screening out more than we were screening in. So what we suggest, and what we have heard from our network partners doing this work on the ground, in addition to survivors, is really allowing them to define what safety means for them. For some, they're going to feel okay and comfortable living in a shelter. For others, they're ready to be in independent living, and for others, they're going to be okay living in the area that they were trafficked. So it really depends on them. I think it's really applying their definition in what they deem as safe, in order to really meet those needs. Oftentimes, we have like our service plan, and we need to meet A, B, and C in order to like meet our goals, but oftentimes our box does not fit, and it does not align with what they would like to do. So that's the only piece I would share.
Debbie or anybody else?
Yeah, I would add, these are all great. Yeah, really thinking about what's working for the survivor at that time. And I'm just also thinking in relation to COVID, there was a worry of just like wanting to message around like shelters are still open, DV providers are still open. And I think that there is a lot of concern about coming into a shelter during this time. So however we can communicate with communities in the field and survivors, that if you're thinking about leaving or having safety concerns, there are a range of options. So like my vision, like we have all these ranges of options for survivors with DV Housing First, and we have a great foundation that's been set up over the years, and now we have DV bonus money that funds rapid rehousing. But it's really like having those models where if a survivor does come in and says, well, I want prevention money because I don't want to have to go back to my abuser, but can't afford my place during COVID because I lost my job, but there's money for that. If there's a need that someone wants to go directly into housing, not to go into a shelter because of health related issues, that there's enough money. If the vision is we have the continuums and we have the models, it's always just bolstering them up and more resources for all those, so that when a survivor does come to access resources during that time and during COVID, that we're able to say, yes, we can get you into the rapid rehousing project that's funded with DV bonus money, or we can get you into the transitional housing program with OVW, but there's the resource piece always.
Well, and to piggyback on what Karen was saying about safety, for those that don't work in the human trafficking arena, just always be mindful if you have somebody coming out of organized crime trafficking or out of a pedophile ring, those trafficking groups generally have members that have access to databases and to publicly available information, or they can bypass and learn things that are beyond publicly available information. So when you get a victim in and you're just signing them up for public assistance and signing them up for that and signing up for that and getting all their ID and stuff, you're throwing a lot of their private information out there for someone who's very savvy or very connected to locate them very quickly.
Mm-hmm.
Thank you. So when we started this webinar, actually, I think Debbie's first comment centered the intersection of gender violence, homelessness, and housing instability, COVID-19, and the disparate impact it's having. So we do have a question about, what are people doing? What are we observing? And what are people doing at that intersection of race, gender violence, homelessness, and disparate outcome? What are some ways that we're working towards more equitable interventions? Who'd like to start there?
In Los Angeles, our head continuum of care has really done about 4 years of work in this area, first starting with a deep exploration of women's experience of homelessness, and then moving to Black people's experience of homelessness. So deep dives into the data that we have available, very integrated and community meetings, lots of engagement on this topic. And so now there's a little more awareness about who's getting resources, and making sure that they're proportionate to who is most likely to experience homelessness. And so, for example, with the hotels, people are very mindful. We already have aggregate data of hotel residents by race, gender, age. And as we're trying to prioritize permanent housing, being mindful of, making sure that folks that African Americans are proportionately finding permanent resources, and that women are proportionally finding housing resources. So these are conversations that I'm hearing on calls all the time. And I know National Alliance has some good resources. Corporation for Supportive Housing has just released some toolkits around this as well. Very, very important, especially since our coordinated entry systems are literally changing right now.
Yeah, I would add that there is definitely a time that we are nimble and we can shift prioritization. What was prioritized for communities can shift during this time, so it can be shifted to those that are disproportionately impacted by historical discrimination and the intersection of COVID around the health disparities. So prioritizing Native American communities, Latinx, and African American communities. And I also think some really innovative work that's happened in communities is thinking about systemic change and where the resources and the funding with continuums of care being funded. So, for example, a lot of Latinx communities have very serious concerns about going to mainstream organizations at times, and especially during this time. So thinking about, like, if there is a Latinx or culturally specific organization that's doing housing, getting the resources to that organization where it's known within the community. Similarly, like LGBTQ organizations where people feel connected and know people there, so they're going to go to people within their community to get those housing resources. So that's been really effective at seeing the continuum of care money going to culturally specific orgs as well.
I've seen that in Los Angeles on the philanthropic side, in the sort of collective pooling of funds and seeing them prioritized to people of color-led organizations, grassroots organizations, and especially supporting undocumented populations who can't access new government benefits right now.
Well, and I will say within, in addition to NSN, one of the other hats I wear is I'm co-founder of Justice Consulting, where we primarily deal with victims of color who are interacting with the criminal justice system. And so within human trafficking, we're doing a poor job anyways of really giving Black girls and Black women and Black victims in general the label of victim or the label of someone who has had a crime perpetrated against them. I mean, the historic research we have in how school systems treat Black children and how social services treat Black families, we already know that we're less likely to see a Black child or a Black woman as a victim than we are a white child or a white woman. So we already have that issue, and it's a huge issue within anti-trafficking. We have many, many girls who are serving life sentences for crimes they committed while in a trafficking situation as a juvenile. So just being very mindful of that, because with that being such a huge intrinsic issue already, it's definitely compounded by the current crisis.
And I'll just add, again, not just during COVID, but all the time, it's really important to have staff members that look and sound like those individuals that you're serving. And so it's really, really important to, now that we're in this situation, it's great that there's, I think, more prioritization of these needs and challenges. But I think, it does give us an opportunity to really move forward and not go back. Once we go back to normal, there will be no normal, right? We have to keep improving from here on out. Yeah, I was like, so so I think that is really great to really think about those pieces. And also one of the quick pieces that I'll add is that what we've been hearing from members is the need to safety plan for around racially motivated attacks. Right now, due to COVID, around our Asian clients, which has been really unfortunate, and another level of trauma, another level of safety planning. But that's something that we were hearing as well.
Thank you. So we don't have much longer, so I'm hoping people can do really succinct answers from here. And also we want to encourage the conversation to continue in our forum, which I'm going to send you a link to. But something that occurs to me, because you've had women and men and youth who have been you know, inherent in this whole trauma experience is powerlessness. And as we're moving people into hotels and other settings for their own good, and we want to keep them inside for their own good, and they really shouldn't do that for their own good. How are you balancing the inherent, you know, how are you balancing that? How are you keeping people empowered? How are you avoiding people's inherent maybe inclination to try and police people when that's really not their job or role? Anybody?
Well, I know when I worked with kids and in child psychology, one of the best ways when you are in a position where you have to have someone choose, they have to do it and you don't want to make them feel like you're controlling them, is to, instead of saying you should do that or you have to do that, say, would you rather do this or that? And so you're kind of giving them two options that meet the goal, but you're putting the power in their hands to decide. And that's not foolproof, obviously, but it does, you know, allow them to have a little bit additional self-determination than they might if you handled it a different way.
Anybody else?
I think from what I've seen is a glow, at least among adults, a really good understanding of what's happening. Like, it's interesting in the Skid Row community where there's normally a number of things happening every single second. It's actually very calm right now. And I think the magnitude has hit people. And we find it's more about educating other folks, like the maintenance staff of the hotel, and, you know, making sure that the way that they're presenting themselves to clean a hotel room is not like, get out of there. It's like, knock, knock, hello. So, and just finding really interesting ways to educate the community right now.
Yeah, I would add that it's been really challenging, especially in the beginning when LA City and County came down with the health orders, trying to help people understand that, you know, we're not asking you to do this. The city and county are mandating that you stay inside. And so I think our staff struggled a little bit because we, you know, have adopted a trauma-informed approach many, many years ago, and it didn't feel very trauma-informed to say, you have to do these things. So what I came up with was, you know, the orders may not be trauma-informed, but the way in which we interact with our participants and share with them what their options are and help them understand what the consequences may be of some of their actions or inaction, then that's the best that we can do. But it's been really challenging to try and communicate those orders in a way that helps them understand that we're still here to support you. We're not going to, you know, put down any consequences if you go beyond these orders, but we would really recommend that you follow them just as all of us are following them.
Yeah, and I would like to add, we've really wanted to message to the field, because this has come up on different conversations and webinars, like what if people are breaking the, you know, the rules and the rules around how we socially distance. And, you know, our goal is that someone does not become homeless or is not asked to leave a program or a shelter as it relates to learning how we all need to interact in this new environment. But if there is a situation that, like, it is creating a tension in a sheltered environment, for example, if you have a survivor who does need to work at their job and healthcare, and people are really worried about exposure and some of the health impacts of that, then there would be some sort of conversation, or potentially that would be the first person to think, like, okay, can we get this person, or would this person want to be able, and could they be safe living in their own housing apartment, versus like, oh, sorry, everyone's uncomfortable, you need to leave. So like the goal is to keep working on things and having the conversations, and that there's solutions that are trauma informed and that do not lead to any sort of houselessness or homelessness, that there's a community responsibility right now people that come into our programs during a pandemic more than ever.
So I'm going to offer a 1 minute. Okay, Samantha, go ahead.
I will keep this like super brief. I will say in my conversations on other issues with Black community leaders, really I feel like the racial disproportionate response is going to be as we reopen and these stages, because we have a lot of working class, primarily white people protesting and leaning on government and leaning on decision makers to reopen everything because they can't pay their bills and they can't make a livelihood, they can't feed their families. And then you have leaders of color who are saying, you know, this is hurting my community, and that's going to put them in jeopardy because their jobs will no longer be protected. They will no longer have landlords that, you know, are not allowed to evict them. And so I think the racial divide is going to become a much bigger issue as we reopen than it even is currently.
And you know, certainly if we go in blind, you know, if we go in with some intentionality, because I think some of the forces that are out there that feed into homelessness, such as foster care, such as jails, such as institutionalization, such as poor jobs, such as no safety net, also have disparity, you know, and so you have, and our job is to make sure that we're doing what we can to dismantle that and not perpetuate or replicate, reify, or, you know, increase it. I want people to give me a one-word answer or two-word answer, and then I'm going to move to closing. And that is, there's some aspects of this work of what we need to do in face of this pandemic that we still need to discuss. So I'm hoping we can post some more resources on our forum and get to some of those and provide those resources. But very quickly, I think one of the things that's most foreign in the DV Housing First world and diversion. So diversion is largely when somebody is calling you for shelter, you know, can you find alternatives to entering shelter for that person? So very quickly, just one or two words, can diversion and prevention work for people who are fleeing domestic violence or trafficking? So that's one word. And then will you be willing to help us share resources and where people can get more information to make sure that when we're diverting or preventing homelessness, they're safe, including issues around restraining orders? Who wants to? I'll give Cicely that because I can't see her wave or anything.
My inability to escape.
I'm sorry, you might have been waving the whole time.
So yes, I believe it does work. It has worked. We have seen some success in it. We've seen greater success in it with folks coming through the mainstream homeless door, but we have seen some success in it. And I think the strategy that has worked for us the best is having, as some of the folks said, the flexible resources on hand to be able to assess the need, figure out what the safety plan is, be it going back to the home, wherever that quote unquote home was, or figuring out another alternative. So, you know, I do believe it works. And yes, we Crossroads would be willing to share resources.
Right. That wasn't one word. Elizabeth.
Sorry.
That's all right. Elizabeth, Amy.
Absolutely.
Thank you.
Ditto, Cicely.
Okay, good. So I'm going to post that. Debbie and Karen, I know, and Samantha could probably have a lot to share too. So if people want to go to the forum, they don't have to do it now. We'll continue that conversation. And Mindy, if you can throw out some slides for me, the closing slides, which I can't see. Maybe it's because I've moved the screen over. No, still can't see it.
I'm not seeing them either.
There's a slide up for more information.
Yeah, that's what I'm looking for.
There you go.
Thank you. So this is the resources. I want to say that Safe Housing Partnership in particular has a bunch of webinars on issues, including landlords and, you know, how do you make this intersection between domestic violence and homelessness and housing? There's a wealth of resources there. as is in all the other organizations. Karen, Freedom Network USA, has been doing weekly webinars, I believe, looking at various aspects of the work. So a whole conversation on shelter and keeping people safe, a whole conversation around around various aspects of building connections between these two systems. Amy and Elizabeth have been very gracious to send me information, as has Samantha, information that we'll be posting up on the forum around how they built a connection between the homeless service system and the domestic violence service system there. And I'll also go ahead and post a link to the researcher's information that she has posted about unsheltered women and what we know about them, and the report from Los Angeles on Black people experiencing homelessness. So you could see the results from a very deep dive into disparity in the homeless services system. Next slide. Continue the conversation. So this is the link, the forum, where we will post information, and hopefully my friends who have been on this call will be willing to answer some more questions that we didn't get to today. I want to say that Mindy and her colleagues on our capacity building team have come up with courses in the Learning Center so people can learn about various aspects of the work. This is not domestic violence specific, but more about how do we implement effective housing responses for people experiencing homelessness. The House Democrats have released a bill yesterday, the day before, that includes a lot more money for the Emergency Solutions Grant Program, which funds shelter, outreach, rehousing efforts. So, hook up with us, let us know, and learn how you can try and persuade your members of Congress to support that. And finally, feel free to reach out to me at any time as well. This is I just met Samantha for the first time this week, just the other day. So I love to hear what people are doing. I constantly am learning from folks. So I don't think there's any more slides, Mindy. So my last job here is to thank everybody for attending, and for the panelists most of all. Thank you very, very much.
Thanks, everybody.
Thank you.
Thank you all.
Thank you.
Thank you.